Black Americans don't want a vaccine because of historical racism. Of course, we talk about Tuskegee, which of course we know is the experiments which ran in the 30s through the 70s, where researchers recruited hundreds of black men in that study on syphilis, and then they tracked the disease and they didn't even treat them, let them know what disease they have. So have you heard from any patients who are still concerned about that study and its lasting effects?
So I deal with community, right? I'm not a frontline provider, but I'm a physician that looks at systems and that treats the system. And I'm talking with community every day, whether it's faith-based settings, whether it's community-based organizations, whether it's a community in the hospital where I work. And yes, people are concerned. They are just as concerned as what has happened in the past as what is happening today. If you look at the story of Dr. Susan Moore, a Black woman physician in Indiana who had coronavirus and unfortunately succumbed to the disease, she had to take to social media to affirm, to advocate, and agitate for her life. She felt she wasn't getting adequate treatment and that there was some level of racist discrimination or bias. So that collective trauma that Black and Brown communities have experienced has not gone away. It's very much there. But I think it's also important to emphasize that is just one issue. The other issue is a lack of access, okay? The other issue is, are we doing a full court press to our Black and Brown communities to decode the science, to demystify the science, and to speak in plain spoken terms so that people understand why and how this vaccine came to market, that it is safe, and that it's effective.